Hello friends, welcome to Mock Test channel. Today we will be going to go through most commonly asked questions in the Medicare exit exam. Friends, before you proceed any further, please make sure that you press on that thumbs up button so that YouTube algorithm understands that this content is very useful for seafarers to pass their Medicare exit exam. What is the proper treatment for heat stroke? A. Rapid cooling of the body. B. Covering with the blanket. C. Exercise. D. Drinking alcohol. Correct answer is rapid cooling of the body. First aid treatment for battery acid or alkali burns, especially A. Flushing with large amount of fresh water seeking medical attention ashore or by radio. B. Wiping the affected area with clean, dry and resting quietly for several hours. C. Drying the acid or alkali with a rag followed by applying a light cream. Correct answer is A. Flushing with large amount of fresh water, seeking medical attention ashore or by radio. If a person is suffering from possible broken bones and internal injuries, is correctly being administered first aid? A. The person should be examined on the scene and then walked to bunk to await and the arrival of medical assistance. B. The person should be moved from the scene but not allowed to walk on their own power without assistance. C. The person should not be allowed to lie down where the injured but should be moved to a chair or bunk. D. The person should not be moved but made comfortable until comfortable medical assistance arrives. Correct answer is the person should not be moved but made comfortable until the medical assistance arrives. Doctor recommend RISE method for treating sprains: rest, ice, dash and elevate. Options are A. Cover, B. Clean, C. Compress, D. Comfort. Correct answer is C. Compress. What action should be taken for a patient suffering from heat exhaustion? A. Moved to be a cool room and told to lie down. B. Kept standing and encouraged to walk slowly and continuously. C. Given a water and told to return to work after 15 minutes of rest. Correct answer is A. Moved to a cool room and told to lie down. What danger to personnel exists when a carbon dioxide fixed fire extinguisher is discharged in a small enclosed space? A. Second degree burns. B. Electric shock. C. Suffocation. D. Burst eardrums. Correct answer is C. Suffocation. Severe exposure to chlorine gas can be fatal. Chlorine gas is primarily a respiratory irritant. B. Skin blurring agent. C. Blood poisoning agent. D. Nerve paralyzing agent. Correct answer is A. Respiratory irritant. Which of the precautions should be taken when treating burns caused by contact with dry lime? A. Water should be applied in fine spray. B. The burnt area should be immersed in water. C. The entire burn area should be covered with ointment. D. Before washing the water, the lime should be brushed away gently and removed from skin contact. Correct answer is B. Before washing with water, lime should be brushed away gently and removed from skin contact. Where there are multiple accident victims, which injury should be first to receive emergency treatment? A. Major multiple fractures. B. Eye injuries. C. Back injuries and spinal cord damage. D. Airway and breathing difficulties. Correct answer is D. Airway and breathing difficulties. Which procedure should not be done for a person who has fainted? A. Revive the person with smelling salts. B. Loosen the clothing. C. Lay the person horizontally. D. Give pain reliever. Correct answer is D. Give pain reliever. Person who has swallowed a non-petroleum based poison are given large quantities of warm soapy water or warm salt water to A. Induce vomiting. B. Absorb the poison from the blood. C. Neutralize the poison in the blood. D. Increase the digestive process and eliminate the poison. Correct answer is A. Induce vomiting. The best treatment for preventing traumatic shock after an accident is to A. Have the victim exercise to increase circulation. B. Keep the victim from electrical equipment. C. Keep the victim warm and dry while lying down. D. Apply ice packs and avoid excitement. The correct answer is keep the victim warm and dry while lying down. The proper stimulant for an unconscious person is A. Tea. B. Coffee. C. Whiskey and water. D. Ammonia inhalant. Correct answer is D. Ammonia inhalant. At what stage of immersion does falling body temperature becomes a primary? A. Initial immersion. B. Short-term immersion. C. Long-term immersion. And D. Post-immersion. Correct answer is C. Long-term immersion. How long can a person survive in cold water? A. 1.5 hours. B. 2.5 hours. C. 4 hours. D. 7 hours. Correct answer is B. 2.5 hours. How much percentage increase in your survival time in the sea if you are in huddle position? A. 20. B. 50. C. 60. D. 75. Correct answer is B. 50 percentage. What will you do if a victim has no pulse and respiration? A. Leave the victim as such. B. Take him to the hospital immediately. C. Start CPR immediately. Correct answer is C. Start CPR immediately. At which method heat loss is by sweating? A. Evaporation. B. Conduction. C. Radiation. D. Convection. Correct answer is A. Evaporation. Humans are A. Cold animal. B. Warm animal. C. Adapt both warm and cold. Correct answer is B. Warm animals. At what stage the person body temperature will continue to drop as the water temperature? A. Initial immersion. B. Short-term immersion. C. Long-term immersion. D. Post-rescue collapse. Correct answer is C. Long-term immersion. Water pulls heat from body at what rate? A. 10 times faster than air. B. 20 times faster than air. C. 30 times faster than air. D. 25 times faster than air. Correct answer is D. 25 times faster than air. What symptoms indicate a need of emergency care in hypothermia? A. Stumbling. B. Blueness of skin. C. Disorientation. D. Poor coordination. Correct answer is C. Disorientation. The accepted treatment for sprained ankle is A. Remove the shoe and check swelling using a capillary reflex method. B. Keep the shoe on, apply bandage for support, elevate and apply cold towels. C. Keep the shoe on, apply splint, apply heat if possible. D. Have victim walk or move as soon as possible to prevent stiffness. Correct answer is keep the shoe on, apply bandage for support, elevate and apply cold towels. Green stick fracture is A. Fracture that happens on twig. B. Fracture that is hardly noticed. C. Fracture in children. D. An irreparable fracture. Correct answer is D. An irreparable fracture. What area the non-absorbable sutures material? A. Dexon. B. Nylon. C. Vicryl. Correct answer is B. Nylon. What are the intravenous injection site except A. Veins of the dorsal. B. Veins of the forearm. C. Veins of the thigh. D. Veins of the foot. Correct answer is C. Veins of the thigh. What is the defibrillation energy level for third shock? A 100 joule, B 200 joule, C 200 to 300 joule, D 360 joule. Correct answer is D 360 joule. Before giving CPR, you first make sure A. They are not bleeding, B. They are conscious or unconscious, C. They are not vomiting, D. Are not dead. Correct answer is B. They are conscious or unconscious. The accepted treatment for femur or thigh fracture is: place a short padded splint on each side of the leg. B. The type of fracture is best handled by those with special training. C. Move the victim before properly applying the leg splint. D. Bind both legs with two long splints using two cravats, one above and one below the break. Correct answer is B. This type of fracture is best handled by those with special training. What is the length of adult male endotracheal tube? A. 21 centimeter, B. 22 centimeter, C. 23 centimeter, D. 24 centimeter. Correct answer is C. 23 centimeter. Friends, make sure that you go through the next part of this video section. I wish you all the best for your exam.